Welcome to this training video for NPT COVID-19 Response Volunteers. Together with other information you'll receive along the way, this video will explain more about how we can work together to help vulnerable residents through the winter months ahead. Firstly though, on behalf of all groups and organisations involved with this initiative, thank you for volunteering to make a positive difference in your community. To start us off, here's a reminder of what this initiative is all about, who it's aimed at, and how we can help residents as the coronavirus pandemic continues. As COVID-19 infection rates rise, partner organisations are collaborating again to support the most vulnerable people in our communities. Most people can rely on family, friends or neighbours, but some people have no support. It's these people that we stand ready again to help. Those who may have volunteered during the first national lockdown will notice some changes to the way we're working this time. The fundamentals have not changed though. We're all working together to support vulnerable people with daily living tasks such as getting food and medication, running errands, and keeping in touch. The aims of this training video are to explain the types of roles volunteers can carry out, to give you the knowledge to be able to undertake your role safely and effectively, to tell you about the support you'll get along the way, and to help you decide if the role of COVID-19 Response Volunteer is right for you. Let's now look at the main roles volunteers may be asked to carry out. These include helping with food. You may be asked to arrange food deliveries for those you're helping. Medication. Picking up and delivering prescriptions and medicines. Daily errands, from posting letters to walking dogs. And social support. Keeping in regular touch with vulnerable residents will make a huge difference to them. Here are some important things to consider if you're thinking of becoming a volunteer. You should only volunteer if you're feeling well and don't have symptoms of coronavirus at this time. No one should be put under pressure to volunteer. Some individuals are considered to be at higher risk should they contract coronavirus. For example, those who are extremely vulnerable or in an increased risk group themselves. If you are in a higher risk group, you must be prepared to take extra care or alternatively opt for a home-based volunteering role. Some volunteer roles may require background checks or enhanced DBS checks. Where these are needed, they will be clearly identified. OK, let's now look closer at the main ways you, as a volunteer, can help vulnerable residents at this time. Starting with shopping. There are 3 main ways you can help people with shopping. Option 1. If possible, encourage residents to order and pay for their shopping online. Option 2. Encourage residents to place an order and pay for items by phone with a local shop that can deliver. Option 3. If a local shop can take an order over the phone but can't deliver, you can arrange to collect the shopping and deliver to the resident's doorstep yourself. By the way, you can find listings of all local shops and services in Neath, Talbot on the Council's website. That's npt.gov.uk/buy local. If the resident you're helping prefers option 3, that's to order from a local shop that can't, however, deliver, there are a few important rules you need to follow. Firstly, agree with the resident when you'll be able to collect the shopping and deliver it. Wash or sanitise hands before picking up the shopping, following the current Welsh Government and Public Health Wales guidelines. Observe the 2 metre social distance rule and, of course, wear a face covering in shops and on public transport. So, collect the shopping as agreed and deliver to the resident's door. Remember to step back from the doorstep when waiting for the resident to collect their shopping. Then wash or sanitise your hands again after you've delivered the shopping. You may be thinking what you should do if a resident can't or doesn't want to order online or over the phone. If you are, here's some advice. If you're asked to purchase the shopping yourself and deliver it to the resident, please check whether the organisation you're volunteering for allows you to. The resident should be made aware that their shopping does need to be paid for. This could be done by cheque, BACS payment, invoice or cash, depending on the resident and the shop. Agree how the items will be paid for in advance, and always encourage other methods of payment first before you discuss using cash. If cash is the only option, remember you'll be reimbursed by either your organisation or the resident directly. Now, here's some more advice for you if you agree to shop for a resident and deliver the goods to them yourself. Take the shopping order from the resident over the phone. Make a note of the items and then repeat the list back to them to confirm you've not missed anything. Use your discretion. Try and stick to food and essential items only. Purchasing alcohol or tobacco products is not encouraged. Confirm roughly how much the shopping will be and agree with the resident when you're able to collect the shopping. After you've shopped and paid for the items, please remember to take a photograph of the receipt. Place the original receipt with the shopping and deliver to the resident's doorstep at the time you agreed. Like before, step back from the doorstep while you wait for the resident to answer. If the resident is paying cash to you directly, give them time to place the cash on the doorstep for you to collect. Then collect the cash after the resident has closed the door. If you've agreed for the resident to sort out the payment via your organisation, please send in the picture of the receipt so that they can reimburse you. And remember again, wash your hands regularly and follow Welsh Government and Public Health Wales advice at all times when shopping and delivering the goods. OK, another important role volunteers may be asked to carry out is making sure residents continue to get vital medication and prescriptions. This is how you could offer to help. Firstly, encourage residents to arrange home deliveries from pharmacies. If a pharmacy is unable to deliver, you can collect, but only if residents agree this with the pharmacy beforehand. Medicines need to be delivered to the resident's doorstep, following the same procedure and safety guidelines as we went through for shopping. This includes washing your hands before and after delivering and stepping back from the doorstep. Please let your organisation's coordinator know if you're experiencing any difficulties providing this service. Daily living support is a key activity of the volunteers helping their neighbours across Neath Talbot. Now on to other things you may be asked to help with. We'll call these things daily errands. These might include helping to shop for other essentials, posting mail, or taking a resident's dog out for walkies. Remember, if you're worried about a task you've been asked to carry out, please call your organisation's designated contact. As a volunteer, you have the right to refuse a task if you don't feel it's appropriate. We don't advise entering a resident's home if this can be at all avoided. However, in exceptional circumstances, if you must enter the property and you're comfortable doing this, here's some advice. First off, establish whether anyone in the property has COVID-19 symptoms. If someone does have symptoms, seek advice from your coordinator before taking further action. Always ask the resident to retreat into another room. Wash or sanitise your hands before going in. Follow the current Welsh Government and Public Health Wales guidelines at all times. Stay at least 2 metres away from residents and wear a face covering. Place the items where the resident asks you to. Then make the resident aware that you're leaving and ask them to remain in the other room until you've gone. Again, wash or sanitise your hands after leaving. Social support is just as important as the practical help we can give vulnerable and isolated residents at this time. As we've said, keeping in contact and checking on their welfare will ensure they're looked after. Here are some pointers then on your role in providing social support. Keep in regular contact with residents, check on their welfare and if they're taking care of themselves. Find out how they're feeling and coping. Encourage them to express their concerns. Reflect what they say back to them in your own words to show you understand. Get the resident talking about their ideas, hobbies and interests to move them into a happier, more resilient place. Note down any requests they make and the actions you've agreed to take. This is important. If you decide you want to keep in touch with residents by phone, you must ask their permission and get their agreement before sharing numbers. You can still offer support in person, even if you or a resident chooses not to communicate by phone. While providing this kind of social support, you may become aware that further help is needed. For instance, if you feel a resident would benefit from a telephone befriender or support from specialist services, please flag this up with your coordinator. Or if you feel worried about the resident in any way, speak to the designated contact within your organisation. Alternatively, you can always contact the Social Services Gateway team or the Emergency Duty team on the number shown on screen. Or call 999 if there is an immediate danger. Let's now focus on you. What is expected of a COVID-19 response volunteer? You'll be totally committed to supporting residents you're matched with. You must be able to follow guidance and direction from your organisation, able to make responsible decisions and offer emotional and practical support. You'll understand and believe in equality of opportunity. You need to stay at home if you feel unwell. Agree payment methods for residents shopping in advance. You'll not request personal details from the resident. You'll get help or arrange cover if you're unable to carry out your agreed tasks. And it goes without saying, you won't break the law. Criminal or illegal activity while volunteering will be reported to the police. As just mentioned, all volunteers are expected to be committed to promoting equal opportunities. With reference to the 2010 Equalities Act, we must all do what we can to make sure people are treated fairly when considering age, disability, gender reassignment, race, religion or belief, sex, sexual orientation, marriage and civil partnership, pregnancy and maternity. As you'll understand, there needs to be clear boundaries and guidelines for all volunteers. These are there not only to help you, but to help residents understand the kind of help you're able to offer. Just think, what would be the difference between a friend and an NPT COVID-19 Response Volunteer? As a response volunteer, you're representing the organisation you're volunteering for. And always consider the possible consequences of your behaviour and the impression it gives. So far, we've covered things that you, as a volunteer, should be considering and things you should be prepared to do. Time now to cover things that you should avoid doing. Please do not enter a resident's home unless it's been pre-arranged and agreed. Don't get involved with any practical services that haven't been agreed in advance. Don't give your phone number or address unless, as we've said, you agree to do this with the resident. Don't text a resident unless you've already agreed to communicate in this way. Don't connect with residents via social media. And don't be tempted to give advice. This role is not an advisory role. Avoid handling cash unless pre-arranged and agreed. And of course, do not share residents' personal data with anyone outside your group or organisation. As we've established, as a COVID-19 response volunteer, you'll be supporting vulnerable individuals. Being vulnerable means that they're susceptible and can often be taken advantage of, targeted or abused. Your role as a volunteer is also a safeguarding one. Safeguarding means protecting children or vulnerable adults from abuse or neglect. Recognise and report any safeguarding concerns to your coordinator. Remember, safeguarding is everyone's responsibility. There are many forms of abuse that you'll need to be aware of and look out for. These include financial abuse, Vulnerable individuals are easy prey to financial abuse by scammers, and those, including strangers, paid carers, relatives or even neighbours, who could steal from them, defraud them, or put pressure on them around wills. Neglect. Individuals may suffer neglect because they're unable to care for themselves, or may not want to bother people, and may not be getting the appropriate support from social services. Children and vulnerable adults may also be neglected if those who should care for them do not provide the care they need. Physical or sexual abuse. Although less common, physical and sexual abuse cannot be ignored. Statistics show incidences of domestic abuse have risen during the coronavirus outbreak. Listen out for the signs, such as noises in the background on calls. Emotional or psychological harm or abuse. This is a consequence of experiencing the other forms of abuse and can also occur alone. Although this might be tricky to spot, listen out for signs such as fear in a person's voice. When considering safeguarding, here are some essential do's and don'ts. Do: be alert to signs of abuse. Become aware of interactions and relationships. Listen and ask open questions. Record any concerns as soon as possible. Report those concerns to your coordinator as soon as possible. And contact the emergency services where there is an immediate risk to a vulnerable resident. Please don't jump to conclusions or make assumptions. Take what you're told at face value, or try to tackle things on your own. To summarise, here are 3 steps to safeguarding. Keep these in mind at all times. Step 1. Listen. Stay calm, clarify, and do not prompt. Step 2. Report your safeguarding concerns. Contact the named coordinator in your organisation or contact the Social Services Gateway team or Emergency Duty team, again on the numbers shown. Or, as we've said, call 999 if there is an immediate danger. Step 3. Record your safeguarding concerns for the record. Write down exactly what was said or witnessed. Finally, remember, health must come first. Please remain at home if you or anyone you've been in contact with starts to experience any symptoms of COVID-19. You'll find latest updates, advice and guidance around coronavirus on the Welsh Government and Public Health Wales websites. If you haven't already made contact about volunteering and would like to know more, please email volunteering@npt.gov.uk or volunteer@nptcvs.org.uk. Thanks for watching this training video. We do hope that you now feel ready to carry out your role as an NPT COVID-19 Response Volunteer. Once again, on behalf of all involved in this initiative, thank you.